Hello, my name is Brenda. I'm going to be your nurse for today.
Hi, Brenda.
Can I get your name, please?
Nadia Mola.
Okay, your date of birth?
4/3/90.
Okay, can you tell me where we are today?
We are in my house.
Okay, and what year is it?
2020, and what a year it's been.
Perfect. Let me say that again. Okay, so Nadia, today we're going to do a focused upper musculoskeletal and neurological assessment.
Okay.
Basically, what that's going to do is we're going to check the function of your neuromuscular system.
Okay.
We're going to assess for a range of motion and strength of your upper extremities, and we're going to check for sensation and if there's any presence of pain.
Sounds good.
Perfect. Can we start off with some questions first?
Sure.
Nadia, I'm going to ask you some questions.
Okay.
Okay. How old are you?
30.
What is your ethnic background?
Hispanic.
Are you left or right-handed?
Right-handed.
Okay. Have you had any physical trauma or injury to your musculoskeletal system?
No.
Do you have a history of stroke?
No.
Cancer?
Mm-mm.
Polio? Parathyroid problems?
Mm-mm.
Excellent. Have you had any surgery to your musculoskeletal system?
No.
Excellent. Do any of your family members or siblings have any problems with their joints, bones, or muscles?
Mm-mm.
Okay, excellent. Do you have any pain today?
A little bit in my neck.
In your neck? Okay. What is it in one spot or is it radiate?
It's like in one spot, and then every now and then I'll like feel it kind of radiate.
Okay.
Like
What
the
is
stiffness like spreads.
So it's stiffness.
Yeah.
Okay. Is it come and go or is it constant?
It comes and go. Like I'll feel it like tighten up, and it's like, oh, okay, gotta relax.
Okay. From 1 to 10, 1 being not very painful to 10 being very painful, what would you rate it as?
It's like a 3, 2, not too off, not too bad, but it's just uncomfortable.
And does it impair any of your activities of daily living?
Not really. I sit at a desk all day, so I guess like with that, it kind of like aggravates it a little bit.
Okay.
So, I got poor posture and stuff. So.
Okay. Do you take any medications?
I take over-the-counter vitamins, and then I'll do like an anti-inflammatory if it gets too bad.
Okay. Are you on birth control?
No.
Okay. Do you take any? You said you take anti-inflammatories.
Yeah.
Okay. Do you take any steroids?
No.
Muscle relaxers?
No.
Any alternative therapies?
I'll do like a hot compress with like lavender essential oil on it, help me relax and stuff. Every now and then. Like with the anti-inflammatory, I'll go ahead and, well, I guess that's counteracted, huh? Yeah. Oops.
Do you what do you do for work?
I
Sorry.
like I have like a very stressful deadline driven kind of like career, and that requires me to be on the computer for like 8+ hours. So
Okay. Do you smoke?
No.
Do you consume alcohol?
yeah, throughout the week.
Okay. Do you use any illicit drugs?
No.
Okay. Let's talk about your nutrition a little bit. Do you consume dairy?
Mm-hmm.
Okay. How many servings of dairy a day?
Like 1 to 3 servings. It depends.
Okay. Do you get sunlight exposure daily?
Mm-hmm. I try to.
Do you practice any sports or do any hobbies?
I like to do like yoga when I can, and then I like to also ride a bicycle, like road bike. So that position too, I'm sure probably aggravates my posture and my sleeping habits or whatever.
Do you wear protective helmets and padding?
Most of the time, yes, but not always. So I sometimes, I'm super confident. So
Okay.
I'm dangerous.
Gotcha. Thank you for those questions. Now we're going to do the vital signs. Okay. So we're going to do your vital signs first.
Okay.
Let me wash my hands and put on some gloves.
All right.
Gloves. Perfect. So let me take your temperature. .1. I can have you just put this on your finger. Excellent. Let me just set a timer here. Do your respirations. Just relax. Hold this apart. respirations are 18. Your blood pressure is 98/68, with your pulse being at 85. Your oxygen saturation is at 98, and that's all within normal. And your temperature was 97.1. Okay, now we're going to proceed to the assessment part.
Okay.
So we're going to test your cranial nerves.
Okay.
Okay? So let me have you close your eyes and cover one nostril up. Can you breathe out of that nostril?
Mhm.
Perfect. Can you smell that?
Mhm.
Excellent. Now cover the other one. Can you breathe out of that nostril? Okay.
A little bit.
Can you smell that?
Yeah.
Excellent. Okay. I see you wear glasses. Are those for corrective visioning?
Yeah.
Excellent. Put them back on for me.
Okay.
How many fingers am I holding?
2.
And then how many fingers am I holding?
5.
Excellent. Okay, so now let me have you take your glasses back off, and what I'm going to have you do is follow my pen light.
Okay.
Try to keep your head as still as possible. So we're going to go. Excellent. Awesome. Perfect. Now look at my finger and switch to the pen. Finger, pen, finger, pen. Excellent. Now look at me. I'm going to check your reflexes. Just look at me. Excellent. Perfect. What I'm going to have you do now is if you can close your eyes for me, and we're going to test your sensation in your face. Are you able to feel this?
Mhm.
Do you feel anything?
Mhm.
Do you feel anything?
Mhm.
Excellent. Now tell me if it's dull or sharp.
Dull. Sharp. Dull. Sharp.
Perfect. Okay, now I'm gonna have you put your glasses back on, and then if you can just make a biting motion for me. Excellent. Perfect. So sensations, let me have you wrinkle your forehead, puff out your cheeks. Perfect. Okay, so now if I could have you open your mouth, let me check your uvula. Uvula is midline. And now if I can have you just cough. Excellent. Okay, what we're gonna have you do now is just stand where you are. I'm gonna whisper 3 words on one side, and you're gonna repeat which words I'm whispering. Just look forward for me, and repeat the words for me.
Cat, dog, mouse.
Excellent, stay where you're at.
Banana, apple, orange.
Perfect. Okay. What I'm gonna have you do now is if you can stick your tongue out for me. Now poke it on one cheek, the other one. Excellent. Can you move your head to each side? Perfect. Other side. Excellent. And now I'm going to put resistance on your shoulders, and I just want you to shrug them up, okay?
Okay.
Shrug them up. Excellent. One more time. Perfect. And then I'm going to ask you, do you know what a French fry or chips taste like?
Yeah. Salty.
Perfect. And what about candy?
Sweet.
Awesome. Okay, so that concludes the cranial nerve assessment. Now we're going to move on to the musculoskeletal assessment.
Okay.
Musculoskeletal assessment.
Okay.
If I can just have you stand on your side. Perfect. We're going to observe for the curves of the spine. Excellent. Stay here. The back for symmetry. Excellent. And then the front for symmetry. Perfect. Okay, what I'm going to have you do first is we're going to test for the range of motion of your cervical spine. So first, let me have you put your chin to your chest all the way, and at any point let me know if there's any discomfort. Okay, now put it all the way back as far as you can. Excellent. Okay, back to me. And now if you can, look to your left. Look to your right. Excellent.
Here there's like a little bit of tenseness.
Okay, so when you look to your right, there's a little bit of tense. Okay. Now what I'm going to have you do is put your ear to the shoulders, keeping your shoulders in place.
Here it's super tight.
Okay, so the right side again.
Pretty tight too.
On the left side. Okay, excellent. So now what we're gonna do is I'm gonna put some resistance on your head. So just try to push my hand. Now look to your left. Excellent. Now we do the right. Perfect. And now the side again. Okay. And the other side. Okay. Excellent. So what I'm gonna have you do now is, if you can, just touch your toes. Lean forward, gonna touch reflection. Excellent. And now what I'm gonna have you do is arch your back. Try to go backwards and hyperextend. Perfect. Okay. From there, we're gonna go and we're gonna look at the symmetry. Okay, just inspect the area. So if you may, I'm gonna palpate here for any masses. There's no changes in color. Perfect. I'm gonna do the same in the back. We're gonna palpate here, the bony prominences. I'm gonna check the traps. I'm gonna check the vertebrae. I'm gonna check the sinus process. Okay, and the paravertebrals. Okay, now if I can have you facing me again. Okay, what we're gonna do now is we're gonna check for range of motion in your arms.
Okay.
So what I'm gonna have you do is, if you can extend your arms forward. Excellent. Now try to pull them back as far as you can. Excellent. Now I'm gonna put some resistance. Try to pull your arms forward again. And now press against my resistance. Excellent. And now the same going back. Check against my resistance. Excellent. Now what I'm gonna have you do is put your arms to the side with your palms down. Perfect. Now put your palms up, and now we're gonna clap our palms. We're gonna put them behind our head, and then we're gonna put them behind our back. Excellent. Okay, now we're gonna check your elbows. Inspect your elbows here. Inspect both sides. Okay, we're gonna palpate for any tenderness. Okay. Okay. No masses. Now what I'm gonna have you do is bend your elbows together. Check for symmetry. Awesome. Okay, now what I'm gonna have you do, same with your elbows. Put your arms towards your shoulders and now extend them out. Perfect. Now put your arms forward. And now I want you to palms out. You can put palms out. And now palms in. That way, no discomfort. You can put them back down. Now hold your arm to your shoulder again. Now I'm gonna pull, and you try to pull towards your direction. Okay?
Okay.
So it's more resistant. And now I'm gonna push, and you try to push out. Excellent. The other side. Same thing. I'm gonna pull, you pull towards you. And I'm gonna push, you push towards me. Perfect. Okay, so now we're going to check for your wrist range of motion. Okay, so we're gonna inspect for symmetry. Perfect. Looks the same. Excellent. Now I'm gonna palpate just for tenderness. Let me know if you feel any discomfort. Okay. Okay. Excellent. Okay. Excellent. Each finger for palpate. Okay. So now with the wrist, I'm gonna have you hold them out. And now I'm gonna have you bend down, bend up. Now bend them towards each other, and now out. Excellent. Now I'm gonna do that with resistance again. So if you can, up, excellent. Bend them down, perfect. In, awesome, and then out, perfect. Okay, so we're gonna do the same with your fingers now. If you can just put your fingers out, make a fist for me. Put them out again. Just hyperextend your thumb as far towards that you can. Perfect. Okay, now I want you to make a fist, and as hard as you can, just press on my hands. Wow, you're really strong. Perfect. Okay, so now we're going to do the same thing with resistance. Okay, so with your fingers, pull them up and against my resistance. Okay, now down. Excellent. Awesome. So that completes the musculoskeletal. Now we're going to check some more things, okay? A few more things to check. I see that there's no muscle twitching, there's no fibrillation or spasm going on, which is great. Let's check your TMJ joint. Okay, so if I may, and now just open and close your mouth. Perfect. No crepitus evident. Excellent. And now what I want you to do is move your jaw from side to side. And now forward, protrusion, back. Excellent. Okay, so for these next things, I'm going to have you close your eyes, okay? So close your eyes and hold your hand out for me. I'm going to ask you what shape I'm drawing on your hand, and I'm going to draw two shapes. Circle. Excellent.
And triangle.
Awesome. And to the other side.
One more time.
Square. Excellent. Circle. Perfect. Okay, so I'm going to put something, keep your eyes closed. I'm going to put something in your hand and you just let me know what that item is, okay?
It feels like a ketchup packet.
Excellent. A key. Perfect. Okay, keep your eyes closed, and now I want you to tell me if you feel 2 points or 1 point in your hand, okay? 2. Okay. 1. 2. Okay. 1. Excellent. Awesome. You can open your eyes back up. The next thing we're going to check for is, actually keep them closed again. Sorry about that. Okay, so now hold your fingers out for me. And then I'm going to move your finger and you just let me know if it's facing down or up, okay?
Down. Up. Down. Up. Down. Up.
Perfect. Okay. The next thing we're going to check, you can open your eyes back up. The next thing we're going to check for is carpal tunnel.
Okay.
What I'm going to have you do is just press both arms towards, and we're going to hold this for about 60 seconds. Let me know if you feel any sensations in your arms, any numbness, tingling, anything of that nature, okay? So I will let you know when the 60 seconds are up.
Okay.
So this was going to check for carpal tunnel syndrome. Okay.
So numbness and tingling.
If you feel any numbness or tingling, just let me know.
Okay.
Just a few more seconds. Okay, you can let them go. Any sensations, any pain?
No.
Excellent. And now one more thing, I'm gonna do another test to check for carpal tunnel. And check your index finger. We're just gonna tap here. Just relax your arm for me. This is your median nerve. Okay, any pain there?
No.
Excellent. Other arm. Take your index. Perfect. Any pain?
No.
Tingling? Numbness? Awesome. Okay, so the next things we're going to do is we're going to check for the reflexes. I'm going to grab my reflex hammer, and where we're going to check for the brachioradialis is if you can hold your arm for me, 3 inches above the wrist. I'm going to strike here, and we're going to see if it elicits a response. There you go. Perfect. There's a response. And perfect. Okay, now we're going to check the bicep
Okay.
reflex. So what I'm going to have you do is make a bicep for me. Excellent. Not so strong. So this here, I'm gonna hold my finger here. You can relax your arm. I'm gonna strike here and we're gonna see if there's a response. Perfect. Same thing on the other side. Make a bicep for me. Make a bicep. Okay. Excellent. Now relax your arm. I'm gonna hold my thumb here and let's see if there is a response. Perfect. Okay, now we're gonna check your triceps. So what I'm gonna have you do is just relax your arm as much as you can. I'm gonna strike your arm right here, above your elbow, and then we're gonna see if there's a response from the triceps. Okay. Same thing on this side, just relax your arm for me. Excellent. So now we're gonna grab the tuning fork and we're gonna check for vibrations. So let me have you close your eyes and let me know if you feel vibrations. Hold your arm out for me. No, you can relax it. Do you feel anything?
Mm-hmm.
Excellent.
Mm-hmm.
Perfect. Other arm.
Mm-hmm.
Excellent.
Mm-hmm.
Perfect. Awesome. Thank you so much, Nadia.